Hello, I'm Jeannie Sims, a certified asthma educator for Breathe, Pennsylvania, and I'm so glad you're able to join us today for understanding my child's asthma inhaler medications and devices. Breathe, Pennsylvania is a nonprofit organization in a 10-county area of Western Pennsylvania. We provide programs in person, real-time, virtual, and recorded. I'm involved with the School Asthma Initiative. This program provides asthma education, training, and intervention services. It's provided for children with asthma and their parent or caregiver, early learning practitioners, school personnel, students with asthma K through 8th grade, professional students, healthcare professionals, and community health workers. For adults with COPD, we have a direct lung disease education program, a sleep apnea program. Every year we hold a tuberculosis conference, and every other year we hold an asthma day for children ages 5 to 10 and their families. For students caught on campus with a tobacco product, they can elect to take our Smokeless Saturday program in lieu of going before the magistrate. And for adults who want to quit, they're smoke-free for life. There is no potential conflict of interest, no commercial support for this activity, and there is no endorsement by Breathe PA for any commercial product. This information in the PowerPoint is in general in nature and for information and educational purposes only. It is not meant to give specific medical advice, recommendations, diagnosis, or treatment. Today, we're going to briefly discuss asthma inhaler medications, purpose, types, and devices. But before we begin, I'd like to share a short video with you on how our lungs work so we can better understand asthma. We breathe air in through our nose and our mouth. It travels down our throat and into the first large airway of the lungs. This is called your trachea. The trachea then splits into two large bronchi, one into each lung, which continues to split within each of the lungs to tinier and tinier bronchioles until they reach the end, or the alveoli, air sacs. Here's where the blood picks up the oxygen, carries it to the heart. The heart pumps the oxygen throughout the body for energy and life, bringing back to the lungs to finish the cycle the carbon dioxide, which follows the same path from alveoli or air sacs up through the tiny bronchioles, out through the bronchi into the trachea, up out of the throat, out of the nose and the mouth. So let's look at the three changes that occur in the airway during an asthma attack. Airway muscles tighten, and these muscles are on the outside of the airway. There's excess mucus produced inside the airway. The airway walls start to swell. Now, if you look at the arrow 2, look how tiny the space is for air to flow in and out of the lungs after these three changes occur during asthma, compared to arrow number 4, where there is no asthma in the airway. Let's look at the purpose of asthma inhaler medications. One is rescue, or your albuterol. It's also called short acting, and it's going to address that muscle on the outside of the airway. The second type of asthma medication is your controller, or what is called a corticosteroid, and it's long acting, and it's going to address the excess mucus and the airway wall swelling. Remember to check the expiration date on all of your medications. So let's talk about the purpose of the rescue, your albuterol, the short-acting inhaler medication. This will help with an asthma attack. It helps to relax the muscles that tighten, helps to clear the mucus from the lungs,
and can start to work in 3 to 5 minutes. Next, let's look at the purpose of your controller medication or corticosteroid, which is long-acting. These medications will help to prevent an asthma attack. They help to reduce swelling and mucus production, lead to fewer symptoms, but they need to be taken daily in order to prevent asthma symptoms. It's also important to rinse your mouth and spit after using this type of inhaler medication to prevent thrush. Next, let's talk about the types of asthma inhalers. There's a metered dose inhaler, or an MDI, a dry powdered inhaler, or a DPI. Here are some insights on your metered dose inhaler, or your MDI. Check the instructions on how to prime your MDI. Priming is where you spray that inhaler into the air when you first purchase it, if you've dropped it, or if you haven't used it for a while. Priming is different for every inhaler, so you need to read the instructions that come in the box. When you use this inhaler, your breath in should be slow and deep. A spacer is recommended to support more medicine reaching the lungs, and it can help reduce side effects. A spacer with a mask attached may also help younger children with their technique. Both rescue and controller inhaler medications come in a metered dose inhaler. So let's take a closer look at that chamber or that spacer. It is an asthma management tool. It allows for more medication to reach the lungs. You experience less side effects from those medications, and it can be used with a rescue or a controller MDI inhaler. Look at the picture to the right. The individual on the left is using the inhaler by itself, and most of the medicine lands in the mouth, the throat, and the stomach, compared to the individual on the right who's attached a spacer to his inhaler. And you see how more of the medicine reaches the lungs. Below this picture, you see a hard spacer, an arrow chamber with a one-way valve mouthpiece, and it also has an expiratory valve at the top to help with technique. You notice on the box on the right, this is a light air or a cardboard spacer, which is not as durable or as expensive. And our young people tend to like it because you can collapse it and fit it in a pocket or a purse. Let's watch a short video on how to use an MDI with a spacer. Remember, it's used with a metered dose inhaler, not a dry powdered inhaler. This is just showing you your inhaler on the left plugged into the spacer that's on the right. You want to take the cap off your spacer and inhaler. Always good to inspect the mouthpieces. Shake it well, and then you're going to prime. Remember, priming and the number of times you prime are different for every inhaler. Just check the box for instructions. Insert the inhaler into the spacer or chamber. Have a person stand up straight or sit up straight. Breathe out. Place the spacer into their mouth. Make a tight seal on that mouthpiece. As you spray the inhaler, one time, inhale slowly and deeply. It's recommended as you breathe in to try to hold your breath up to the count of 10 if possible. And then you're going to breathe out. Repeat if necessary, if you're prescribed a second puff of that medication. When using a corticosteroid, a controller medication inhaler, you want to make sure if you're at home to brush your teeth and spit, or if you're out and about, to rinse your mouth and spit so that you don't get thrush. Now let's look at the dry powdered inhaler and some insights. You do not need to prime, and you do not need to use a spacer with a DPI. Also important, don't exhale into the DPI because it can cause the powder to clump. Sometimes there's issues with high humidity areas. Your breath in should be deep and even. Now I'm going to show you a brief video on some of the devices that house these inhalers. Let's first take a look at the devices. You have an HFA, which is an MDI. You have a digihaler, and they use a lot of technology with this particular inhaler. You have a RespiClick. You have an Ellipta, a Twistaler, a Discus. Another device is a Respimat and a Flexhaler. These devices can house a rescue or controller medication. Some are MDIs and some are DPIs. Talk to your doctor about which is best for you. Now let's watch that short video on how these devices work.
Hi, I'm Nurse Josh, an LPN at Allergy Partners in Lewisburg. First device we'll have here is a twist inhaler. The way we activate this device is we twist off the cap, and then it's activated. We nearly take it to our mouth at that point. Slow, deep inhale. Close it by twisting it back on. And if we're using it twice in that one day, we'll retwist, activates again, another inhale. Every time we activate the device, we do have a counter that will go down and show us how many more inhalations we have left before the device has expired. Next device we have is a Ellipta device. This device is utilized and activated by sliding the lid off to the side. You'll hear a nice audible click. At that time, take it up to our mouth and then a slow, steady inhale. Again, this device has a counter on it to show how many times it activated and how many actuations are left until the device is no longer useful. Next device we have is an HFA inhaler. This is a Symbicort model. Its counter is on top and it will show through and get to yellow and red when it's time to refill. This device is utilized by squeezing the edges to relieve the mouthpiece cover. Take it to our mouth or attach it to a spacer. Give a push down and then slowly inhale the medication. Then we can go ahead and repeat if we're using it 2 times at that period. Next device we have is a Respimat setup. This inhaler style comes in both long-term daily medications and short-term rescue medications. The way we activate it is we will twist or turn. It also has a counter on the side showing how many actuations are left. The device is now activated. We remove the cap, push our gray button as we inhale. Medication will eject and we continue to slowly inhale that medication. If we're using it as a rescue medication, we want to wait 1 minute at minimum before we utilize it again if we're using 2 puffs. Twist, open, activate. Discus inhaler, primarily Advair has discus. We're going to open it up by just sliding the cap over. We have a small lever here that activates the device, bring it up to our mouth and slowly inhale. There is a counter down here which shows how many actuations we have left before the device is no longer good. And it will continue to count down as we activate it. The HandyHaler device, currently Spriva typically comes in this setup. We are going to open up the cap, open up our mouthpiece cover, and there will be a capsule that we'll place down inside. When we place that capsule inside, we will close this. But I'll show you before, we have metal prongs that come across and pierce the capsule. So we'll close this up, we'll activate those prongs, pierce the capsule, put it to our mouth and slowly inhale. You'll hear the rattle of the capsule vibrating and you're going to be sucking the powder out from that capsule. Our RespiClick device, primarily ProAir, makes this one. It's a rescue inhaler setup. The way we activate it is we open the cover, we hear that audible click, then we slowly inhale the dry powder that's inside. We'll then take it away from our mouth, close the capsule, hold our breath for about 10 seconds, and then exhale. There's a counter on the back that will go through and show us how many more active medications we have left. This is a demo, and I've already used it too many times. But again, open it up, inhale, close it, exhale.
Breathe Pennsylvania offers several resources. We have an asthma action workbook and a patient assistance program. Your asthma action workbook is a place for you, your family, your doctor to gather information to share with the school nurse and teachers. It's now been translated into 5 new languages. The patient assistance program offers support with respiratory medications, nebulizers, spacers, peak flow meters, as well as additional education. Well, I want to thank you for joining us today. And if you have questions or looking for additional information, please feel free to email or call your certified asthma educator. Have a great day.